What if I told you the key to the future of high-tech medicine was actually, well, thousands of years old? Welcome to This Explainer. Today, we're diving into the wild convergence of two completely different worlds. On one hand, we've got the cutting-edge predictive power of modern artificial intelligence, and on the other, the ancient holistic wisdom of integrated medicine like Ayurveda. We're going to see how combining wearable technology with whole-person care is shifting us away from a system that just reacts to illness toward a future focused on continuous health creation. It's a literal paradigm shift, and honestly, the data behind it is absolutely fascinating. Okay, here is our roadmap for today. We'll cover the chronic disease crisis, whole-person care, AI and early warning signs, ancient wisdom meeting modern science, the community navigator model, and finally, reimagining the future. Let's get right into it. Section 1, the chronic disease crisis and the limits of reactive medicine. So we kind of have to understand the problem before we can really appreciate the solution, right? Look, modern hospital-centered medicine is absolute magic when it comes to acute trauma or surgery, but it's really struggling under the weight of lifestyle-driven illnesses. Traditionally, medicine has been organized into these organ-based silos. You know the drill. You see a cardiologist for your heart, a neurologist for your brain, an endocrinologist for your hormones. And while that intense specialization has brought us extraordinary advances, human biology doesn't actually work in isolated silos. It operates as this deeply, deeply interconnected network. Because of that, the crucial point is this: chronic diseases absolutely do not respect the boundaries of medical specialties. Take obesity, for instance. It doesn't just affect your weight. It impacts your cardiovascular health, your hormones, inflammation, and even mental well-being. Or diabetes. It cascades across your kidneys, eyes, nerves, and immune function. Treating these complex, network-wide issues with isolated, organ-specific approaches, well, that's exactly why our current systems are becoming totally overwhelmed and, frankly, vastly expensive. Section 2, whole-person care, where biology meets lifestyle. Now, this isn't some rejection of modern science. Actually, it's the next evolution of it. It's so fascinating to see how our daily behaviors interact with our biology through a process called epigenetic regulation. Literally every single day, your choices, stuff like your nutrition, sleep, and physical activity, act as a continuous stream of biological communication with your cells. Food, for example, isn't just calories, right? It provides molecular signals that influence your immunity, inflammation, and cellular function. Whole person care simply acknowledges that lifestyle is quite literally a form of biological medicine. Section 3, AI and early warning signs, making the invisible visible. So, if the body is this interconnected network responding to our lifestyle, how on earth do we track it? Well, artificial intelligence and digital technologies are fundamentally changing the game here. They can actually identify the risk of metabolic deterioration by continuously tracking specific physiological and behavioral data points. And often, this is gathered right from the smartwatch or fitness tracker you might literally be wearing on your wrist right now. Rather than just taking a static snapshot at the doctor's office, AI predictive models constantly evaluate early warning signs. We're talking about things like declining physical activity levels, sleep disturbances and poor sleep quality, detecting subtle arrhythmias, flagging elevated stress hormones, tracking increasing waist circumference, and even spotting unhealthy dietary patterns as they happen. To make sense of all those data points, we use something called risk stratification. This is where AI systems and decision support tools step in to synthesize these real-time data streams with broader, highly specific information. Think along the lines of an individual's genetic profiling, metabolic monitoring, and behavioral assessments. The result? You get a truly comprehensive, multidimensional picture of your health in real time. The ultimate goal here is absolutely clear. By tracking these specific biological and lifestyle markers, predictive analytics can flag early metabolic deterioration long before it evolves into a severe clinical condition requiring hospitalization. So instead of waiting around for a heart attack or a diabetes diagnosis, we can see the dominoes starting to fall months, maybe even years in advance. And that enables proactive, highly targeted interventions. Section 4, Ancient Wisdom, Modern Science, and Integrated Interventions. Okay, so once AI flags these early warning signs, what do we actually do about them? Well, this is where the evidence-based practices of integrated medicine step in as the perfect proactive interventions. Consider the physiological impacts of pranayama or yogic breathing techniques. Say an AI wearable detects elevated stress hormones and reduced heart rate variability. We don't necessarily need to jump straight to a pharmaceutical.
Targeted practices like diaphragmatic breathing directly stimulate the vagus nerve, enhancing parasympathetic activation, which is essentially hitting the biological brakes on your body's stress response. It restores autonomic balance, all without side effects.
And there is a really robust, growing evidence base for specific Ayurvedic botanicals being used safely alongside conventional treatments. For instance, there's moderate evidence for using curcumin and Boswellia serrata for knee osteoarthritis to inhibit inflammatory mediators, or using standardized ashwagandha to help regulate cortisol and manage stress and anxiety. The point here isn't about replacing your doctor. It's about giving them an expanded evidence-based toolkit to address those early AI warnings. Section 5. The Community Navigator Model, Scaling Health. So, how do we deliver these incredible insights and integrated therapies to thousands of people at scale? We clearly need a new systemic approach. And the solution to scaling this up is the Community Navigator Model. Think of a health navigator like, an air traffic controller for a patient's well-being. The journey starts with that AI risk assessment we just discussed. Then, the navigator steps in to coordinate multidisciplinary care, pulling in dietitians, yoga therapists, or health coaches for holistic lifestyle interventions. By aggressively treating the root causes right there in the community, they prevent the disease from escalating to the point where an expensive hospital stay is even required. And honestly, the estimated systemic relief this brings is staggering. By moving care upstream into community holistic treatment centers, models project massive reductions in healthcare utilization. To put that into perspective, we're looking at estimated drops of 18 to 25% in GP consultations, 10 to 18% fewer hospital admissions, and up to a 30% reduction in chronic pain consultations. This isn't just about freeing up hospital beds. It's about radically unburdening the exhausted clinical systems in our own communities, ensuring care is actually there when you truly need it. Which results in an absolutely incredible number, 4-to-1. That is the estimated return on investment for community-based preventative programs like community yoga and lifestyle medicine. For every single dollar or pound invested, the system saves roughly 4 in downstream medical costs, reduced emergency attendances, and fewer medications. It just proves that proactive health creation isn't just biologically sound, it's economically vital. Section 6. Reimagining the Future, Cultivating Human Flourishing. So, what does healthcare look like when we finally get this right? Well, by bringing everything we've discussed together, integrating modern digital diagnostics and predictive AI with the ancient, holistic care of lifestyle medicine and Ayurveda, we completely flip the pyramid. Hospitals obviously remain essential, but really only for acute, specialized care. The vast majority of our healthcare investment shifts upstream into our communities, transforming them from places where we merely manage sickness into vibrant ecosystems of continuous health creation. I want to leave you with a provocative thought to reflect on today. As we integrate these incredible technological tools with timeless biological wisdom, we have to ask ourselves, is the primary goal of healthcare merely to manage illness once it happens? Or is it to empower every single individual to achieve their absolute highest potential for lifelong health? The tools to choose the latter are finally in our hands. Thanks for joining me on this explainer, and keep learning.